Hello everyone, Kent.Bressler here. I want to welcome you to Kent's Kidney Stories. During our time together over these podcasts, I'd like to discuss kidney disease. I'd like to tell you about my journey as a transplant patient, but also talk about dialysis, kidney donation, and just about anything else that might be of interest. Kent's Kidney Stories, podcast endorsed and sponsored by kidneysolutions.org.
Hello, everyone. This is Kent.Bressler, and we're going to do some podcasting today. I hope that you enjoy this one because it's with a very special friend of mine, and I think you're going to enjoy it, and I know she is going to enjoy it. Let's pray. Dearest Lord, we come to you with humble hearts. We ask that you take Michael Etheridge and find that donor, send that donor that he needs so much in his life. And just take the time right now with us, Lord, to give us peace and give us understanding with the things that are going on. We know that we can put everything in your hands and it will be fine. That's all we have to do is put it in your hands. And we know that you will make everything right. We pray to you that you prevent us from any hazards and protect us from what's going on in the world and save all of those folks that are having such a hard time in different parts of the country. But we ask this in all of your name and hope with the best of it that we can find a donor for Michael. Amen. I wanted to talk to you just a little bit about the things that are going on in the kidney space. There's a lot of things with COVID now, folks, that has changed. We know that COVID is still here, but the numbers are going down. We're seeing better outcomes now. I want you to make sure that you've been vaccinated. If you haven't, you need to entertain that with your physician and make sure that you do get vaccinated. But another important thing is to realize that if you have become symptomatic, that you go in for treatment. All right. This virus is not over. And there are some solid treatments now that can help you. All right. So don't lay at home on the couch or think that you'll get over it. If you have symptoms, go right away to the doctor. So with that being said, I want to take this time to introduce to you Rinki Etheridge. Rinki is from California, and she's just I don't know. I met her first off because she called about her husband, and he needs a kidney donor. And I thought, as a caregiver, you should understand that what Rinki's gone through over this time is not something that's any different than most people go through. But the art of being a good caregiver you have a lot of love in your heart, and you're willing to step out of the box and look for the things that will help your loved one. And Rinki's done that, and she keeps doing that. So we thought we'd bring her on in hopes that our conversation with her will guide you in at least bringing somebody into the fold who's willing to donate for Michael. Okay, so with that being said, Rinki, welcome. It's great to see you.
Thank you, Kent. And first of all, I want to say thank you for the beautiful prayer. And the things you said about COVID, I totally agree with it. Like each and every word. Yes, it's not easy. And being vaccinated, yes, I got my booster shot, and my husband got 4 shots of vaccine, but no antibodies. So it's just like there is a lot of unknown right now. We don't
Absolutely.
know. Okay, like the best thing we can do is like keep ourselves protected and keep the environment healthy around him, and not only around him, around people who don't have immune system. We are lucky enough to have immune system. We can fight off the disease. But what about the people who cannot? The only thing we can do is like protect them so that we are not carrying the virus and transmitting it to them. Because if we get it, we might get over it. But if people like him get it, they may die. I should not use these harsh words, but that's a reality. We have seen that happening, right?
Yes. 30% of the 30% of the immunocompromised patients who get this, especially kidney transplant patients, do die.
Yeah.
All right.
Yes. Yeah.
So also I'll just tap onto that just for a second. There's a drug called Evansheld. It's a vaccination that's available to Michael if he talks to his doctor about that. And I would recommend if he hasn't had that, at least he talks to the doctor about that. Okay. Because it is a preventative medication that might very well help him, keep him from getting COVID, or at least keep him safe after he gets it. He won't get so sick. Anyway, that being said, how long have you been searching for? Well, first of all, tell me about Michael's condition. Tell me about Michael. You're his caregiver. You're his sole caregiver, and you've been married to him for a good while. So tell me,
No, we have been married for just 1.5 years.
Okay, I thought you. Sorry about that. Well, okay. So tell me how he's faring. What's gonna give us a little background on Michael?
Yeah. So Michael was born with like bladder, if I say it right, bladder extrophy. So that caused the failure of his native kidneys. So I think when he was like 8 or 9 years old, his native kidneys failed, so he needed a transplant. So his father gave him one of his kidney, and that kidney lasted like a couple of years. And then after he went on dialysis for some time, and then his younger brother, he gave him his kidney. I think my husband was around 18 or 19 years old at that time.
Oh, wow.
So he got the second kidney, and that kidney worked for like long time. I would say like 13 to 14 years. And 3 years ago, it was like, November 2019, he felt some symptoms like edema around like feet and other body parts. And we knew that he was not well because he had like a lot of health issues, high blood pressure, and he was on like immunosuppressant drugs his entire life. And he spent most of his life in UCSF. There is a hospital in San Francisco. So his life was very difficult. So he kind of knew that this kidney is also going to fail, but he didn't know that, okay, this is the time. So in November 2019, doctors perform a biopsy on him, and they found out that kidney is failing. And that was the time, he was also feeling sick and tired. So he quit his jobs. And I met him like in February 2019. So it was just like few months of relationship, but we grew a strong bond. And and I think that happened for good. And I had no idea about like all these things like kidney stuff, like kidneys fail, people go on dialysis, because I'm coming from a different family, different part of the world. And that kind of opened my eyes. I like, okay, there are a lot of people, this is real. There are a lot of people in the world who have kidney failures. They go on dialysis, and how hard the life gets after that. It's not easy. It's not like, I'm a sympathetic person, but after that, I became more empathetic towards everyone. I'm like, okay, we need to realize everyone has their own struggles. I saw him suffering. And from November to like February, we went to India. My sisters got married and we came back. And after that, his health is just like, it's not the same. Like he got high blood pressure. It was like more than 200 or something. Then we had to go to the ER. Yes, that was one scary night for me because we were living together. There was no one around us. And that time we found out, okay, his kidney function has dropped to 19 now, and we need a new kidney.
Yes.
And it was March 2020, around COVID. That time only, like, okay, we started looking for donors. I got the magnetic posters printed in November 2019 when we first got to know that his kidneys started failing, because I didn't know anything about it. I just wanted to make sure that we are doing everything right. and we start the process as soon as possible. I didn't know the waiting time, and I was like, okay, if his kidney is failing right now, we should need to have a donor within few months. It's been like 2.5 years. We
Yes.
have like there is no one in the pipeline who's getting tested, so it's not easy.
No,
Like
it's horribly hard. It's very
it,
difficult. And
yeah,
I've been riding this wave with you for a few months now.
yes,
And I just really I really wanted to have you come on and just tell people this the way you feel about how hard it is to find a kidney donor
yeah,
and how long you have to wait on the list for a deceased donor. It's
yes,
horrible.
it
Maybe
is.
in California, I think it can approach 10 years that
That's
you
what
have to wait.
exactly, that's what we were told. Like because his kidney function dropped to 19, they listed him in the transplant list, but the waiting period, it was 8 to 10 years. I
Yes.
was When I got to know about this, I was like really shocked. I was like, 8 to 10 years, that's a long time. We are just starting our life. We don't like I cannot even imagine like going him with this condition going on dialysis, not able to do anything. And who knows, like this will be his third transplant. If that happens after 8 to 10 years, I don't know whether he will be able to make it. And looking at his current situation, it's scary because it's not only kidney, it's like he has a lot of other issues. And in last 2 years, if I just start counting, we have seen 10 to 11 specialists,
Yes.
like all kind of doctors, like neurologist we are going to see next month, gastrourologist, he had multiple surgeries around his urethra area, because being immunocompromised, it comes with other challenges. Your body cannot fight anything. So if you get any infection or anything, it can become cancerous. So doctors have to perform surgeries to remove those lesions from your body so you don't get cancer.
Yep.
So everything is linked, and it's just making the life difficult.
It's making your life difficult and his even more so. I understand that completely. We've talked about this on several occasions. But your
Yes,
tenacity is unbelievable. Your willingness and your abilities. You're in IT. I understand. You do a lot of work in IT, and so it's not. You're very educated, and you get how tragic this thing is. But you've not given up, and that's what
no,
I want people to know. That this is not an attempt to cry and cry and cry. This is an attempt to bring people up to speed about how difficult this disease is. It's a
yes,
killer.
yeah.
That's all there is to it. And so, what have you actually, you said you got some car magnets. What other kind of things have you done in your journey taking care of Michael? What have you done to try to mobilize a donor? What other things have happened?
So first step was to get a car magnet, not only for my car, not only for his car, but all for each and every family member's car, so that like they can drive around, and if they are going, it just increases the chances of getting a
Mhm.
donor. And next thing was like I created a post on Facebook and Instagram, and I asked people to share it. And other than that, I reached out to you because there were times where I was like, okay, there is no hope. What can I do? People are reaching out, but they are not doing anything, or maybe they want to. COVID is there. I understand that. And it's just like I cannot just sit. I have to try everything else. I saw a post on Instagram from Kidney Solutions, like maybe you posted someone's profile. So I did some research and I reached out to you. So you put his profile on Kidney Solutions. So that is also one of my step to now I'm connected to you like all other people. So that was also one of my initiative. I reached out to a couple of more advocates on LinkedIn, and they told me about their stories. And a few days ago, I was researching and I found American Transplant Foundation. So they have put his profile on their website, and I'm talking to one of the person from that foundation. It's just like sometimes she just helps me out and just talks to me, and she shares her experience. How was it for her husband? So it's just getting support and finding ways to spread the information. And last month I was like, okay, I have tried everything, it's not working. And people do reach out to me every now and then. I share the news, but no one actually does anything. So I spoke to a local newspaper and
Yeah.
to put an ad. So they put an ad on like Sunday and Thursday in two local newspapers. And I was very hopeful. I was like, okay, my mailbox will be full after this, because maybe there are a lot of people who reads newspaper. Even the older generation, they still read. I know, like, these days we are not subscribed to any newspaper or anything, we don't get, but there are a lot of people who still read
Oh,
newspaper.
yes. Lots of people. Yep.
Yeah, but unfortunately I just got not two emails, like two responses. Two people called me. So that was kind of disappointing, thinking like that, okay, newspaper is the best thing you can do, but that is not working. That, like, after that also, like, people who saw his picture in the newspaper, his friends and all, they reached out to him on Facebook and Instagram. But it was just like, okay, we are sorry, all those things, it's fine, but it was not helpful. Like, there is no
No one
one
stepped forward. No one came forward.
no
That's
one
the
came.
honest truth.
That's the honest truth. Like, yeah, so it's disappointing because it's been like more than 2.5, it's like almost 2.5 years.
Yes.
And the pattern I have seen, that there are a lot of people who maybe they have some willingness to help, it's fine, but they have to understand the situation of the family member. Like, it's a matter of life and death. If you are giving someone some hope, just make sure that you really want to do it, right? And I'm not saying, I'm not questioning their willingness or anything, but it's just like, as a family member, it's emotionally frustrating for me to have, like, raising my hopes every time someone calls and then not follow through. I'm like, okay, this is not gonna work, this is not gonna work. And it has happened, like, if I count on finger, there were around 15 to 20 people
Yes.
who had done that. So
Yeah.
right now, if someone tells me now, okay, they want to do it, I don't ask them to sign up straight away. I just say, okay, there is a lot of information available online, I'll share links with you. You need to know what you are doing. Okay, so you will be in a better position to make that decision, whether do you really want to do it. Because donating an organ is a big thing. It's relative. Like,
Oh,
for
it
someone
is.
it can be a huge step, for someone it's like nothing, like we are just helping other person. So I put it on them like, okay, it's your, you just do some research, read about it, and then you find out whether it's a big step for you or not. Still, if you think you want to do it, then this is the process. And they say, yeah, 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 we will do it, we will do it, but then they just don't follow through, and
Yeah.
it's disappointing sometimes.
Well, it's disappointing every time. It's not just sometimes. It's disappointing every
Yeah,
time that happens. And
yeah,
the key here too, like I really, people get pushed to me. I like to be able to talk to them individually
yeah,
and just say, listen, you don't have to make a decision today. We're not pushing you to do that. What we're trying to do is get all your questions answered. If you
yes,
want to be a kidney donor, if you really actually want to do that, there are things that you need to consider. And there are
yeah,
questions floating around in your head right now that I know you want to ask. So get them out. And then we also refer them to other donors, people who have
mhm,
donated. We have
yes,
lots of people have come through Kidney Solutions who have been donors and are willing to talk to potential donors.
yeah,
And we now have a donor coordinator. Okay.
mhm,
And
nice,
so all of these things take time to introduce, but it's not that I've recruited anybody. They've come to the organization because they believe in it. And
yeah,
thank God. And so uh, you have done nothing wrong. I think sometimes caregivers think, what if am I doing everything I should be doing? I don't know how you gauge that. Do you understand? How do
yeah,
you decide when you've done everything you can? If you
yeah,
decide that you have done everything you can, is that then now giving up? Is that
no,
really? No,
no,
absolutely not.
no.
It's
Like,
not giving up.
yes, every day is new, like, and I have a lot of hope. I think like things happen for a reason. There was a reason why I met this guy. There is a reason why things happened, like started happening. It's unfortunate, but I believe like there are a lot of people in the world who want to help. And I just want to say one thing, like it's not only related to kidney. I think if everyone has that willingness to help in any way they can, instead of like saying, okay, I don't think I can do it, it can be anything, like for anyone, then I we can just helping each other in the world in any way is gonna, I think that will give people a lot of hope.
Well, you've inspired me, believe me. Your tenacity is unbelievable. I've talked to, I don't know how many times I've talked to you, I didn't count them, but I can emails and text back and forth trying to just keep you level, right? Just to keep you at a point where you don't give up. I don't think you could give up if you want to know the truth, but everybody needs to have somebody patting them on the back a little or hugging them,
Yeah.
right? Right?
Yeah.
Because if you don't have that huggability, if you can't get into a person's feelings that what you're doing for them means something,
Yeah.
it's difficult. But yeah,
Mhm.
you have to do it. You have no other choice. You're not
Yeah.
going to pack your bags and leave.
No way.
Yeah, see, that's the deal. Because I have known people that have done that. They've abandoned kidney patients, because they just don't. Whatever feelings, I never delve into it, but
Mhm.
they do,
Yeah.
and that's not in your vocabulary. You're
No.
always working, and again, tell me where is it that I think it's in San Francisco. Tell me the hospital. If somebody right now is listening or wants to donate, how would they get a donation, register to be his donor? How would you do that?
Yeah. So I have a link. So the hospital's name is UCSF. That's in San Francisco. And there is a link, direct link for that hospital's website's registration form. So it's like anyone who wants to do it anonymously as well. Like we do not need to know their information.
Nope.
So, but they just need to know his basic information, like first name, last name, date of birth, and his blood group. So maybe I can share the link with you. I need to.
Yeah, I was going to tell people that link is on kidneysolutions.org.
Yeah.
And that can be obtained from giving me a call
Yeah.
at 830-285-2140. It's all at kidneysolutions.org. Michael's up on the website, but all that information is there. But still, you want to make sure that they understand we have answers to questions, because there's got to be a lot of questions that people like, how long am I going to be off work? Will it affect my health? Can I have children after I donate? There's a multitude of different issues that go through a person's head. And we can get somebody to answer those questions for you. We become a mentor for the folks that want to donate, as well as, like for you and Michael. So that's what we do.
Yeah. Just want to add one more thing, like that is something which, because I was the first person who was like, okay, just even though our blood groups don't match, I'm willing to donate. We can do the pair exchange program. And I started the process without telling him, and my labs and everything was fine. I'm very healthy. So, but then I had to speak to him, and he was like, he doesn't want me to do that right now. And the reason is he might need another transplant after few years when he's old, and during that time he might not be in a situation where he can wait. So he will need a transplant sooner than later. So he's just saving like my kidney for the late, like for the future, and not right now. Because I sometimes people ask me, why don't you give your kidney to him? It's not like I don't want to. I would love to do that every, like, even if he says okay just do it, I'm like all in to do that any moment at any point of time. But the reasoning is like, it kind of makes sense to me, like in future, suppose after 10 or 15 years, if his kidney failed again, and that time the waiting period, his body is not ready to be on dialysis for a longer period of time, then he can utilize my kidney, so the transplant will be faster than slower. Yeah.
There's a mechanism, and everybody's paying attention to this, that you can actually go into a situation where you get a voucher for giving a kidney for a later date. You are aware of that?
No.
I will talk to you about that afterwards.
Okay.
I don't want to go in
Sure.
detail here. I want to focus on Michael and you. And so that's just another issue that comes up with this idea that, well, I don't want to do this. Donors say, I don't want to do this because my family might need it down the road, or, you know, my kids might need it, or, yeah, I understand all that, but what are the chances, or what are the odds? This program helps minimize that. And I'm going to have Shannon give you a call and talk to you about it.
Sure.
Right?
Yeah.
The whole process of giving up a kidney is relatively easy. It's
Yeah.
not pain-free, I guarantee you, but it's tolerable. And the feeling that you get after doing such a thing, and I'll just to quote my brother, I had to do it. It was something I had to do.
Yes.
Not just for me, but I felt, you know, that you would do it for me. And so someone
Exactly.
out there right now is listening, and they say, oh, I can do that. Give me a call. We'll talk about it. But always remember that no pressure's ever placed on a donor or a potential. Never. There's never. The transplant does not put any pressure on you. Kidney Solutions isn't going to put it, and the family's not going to put any pressure on you. This should be a decision that the person makes themselves. They should not be, it's not a sales pitch. It's just getting all their questions answered so they can make an informed decision. Do you not feel that's the most important thing, is at least give us an opportunity to talk to you? That's what we're asking you for. If you feel like you want to donate, then give us a call or get a hold of Rinki. Whatever it is, just do it, because we're ready. You comfortable with that, Rinki?
Sure. Yeah, of course.
I think right now in your mind, you if you have anything you want to say, this is short and sweet in the way it should be. You as a caregiver, that's an honorable deed that you're doing, because you're helping, but you're helping a loved one. And we talked about this early on about being married a long time or being short. Doesn't make any difference. Love is the most important part here.
Yeah.
And it solves a lot of things. It makes you sad, it makes you worried, you know, all that stuff. But you know, if you give up, where will you be? Nowhere.
Exactly.
So
Yeah.
find somebody that can help you get through this, that can do this walk with you, and especially someone who's been on this walk before. All right. No
Yeah.
one can guarantee a donor. Absolutely no one can guarantee that someone will do this. But if you don't ask, you'll never know.
Yeah.
And we're asking for you to, let's just talk about Michael Etheridge. Just give us a call at Kidney Solutions or call Rinki. Go online at kidneysolutions.org and we'll work with you and we'll get your questions answered. Then one more thing I want to say, if you do this, if you decide that you're going to become a donor and you sign up and you do all this and you find out that you are not a candidate, i.e. there's something wrong, you may have a hidden condition that you don't even know about that could save your life. None of this costs you a nickel, not even a penny, not even so much as a dime. It's all taken care of by the insurance and by Medicare. Okay. So here's the deal. If you are not capable of giving someone a kidney, at least take this to the bank. We love you for attempting to, and you're a special person just for stepping forward. All right. And if they should happen to find something that eliminates you, we're very happy that you did it. And we're profoundly grateful for just even thinking about it. And that's all I have to say about it. I want you to consider giving a kidney to Rinki's husband, Michael, and you can get a hold of us and we'll help you through it. One last thing, Rinki, that smile, don't ever lose that smile.
Thank you.
These people just don't get a chance to see your smile, but I want you to know you're smiling on the inside too. All right. And you got friends. We're going to help you and we're going to help Michael.
Thank you.
No guarantees, but I guarantee one thing, that will stick with you. All right.
Mhm.
All right.
I just want to add one thing.
Absolutely. Add as many things as you want.
Yeah. So sometimes we think, okay, it is hard for caregivers. Yes, it's all relative how easy and hard things are. But when I see my husband, I think that it's not that hard for me, because for me, it's just emotional. But the person who's going through a kidney failure or any kind of health issues, and if that person has like a lot of pride and everything, it's physically hard for them and it's emotionally hard for them. And the depression they get and the feelings they have that they cannot do anything, they are just stuck in the house bedridden, and they are not, sometimes he tells me that he feels useless, and that scares me because
Oh gosh, yes.
that's not a good feeling, because he's not useless. He has contributed to society, he has done a lot of social work. Whatever time healthy years he got, he was doing a social work, and his area of work was also like, okay, helping people.
Sure.
So yeah, I just want to tell everyone, like, don't feel that way. Whenever, like, our priority is just to make sure that you survive and you are healthy, and it's not a burden for us, it's a chance for us, like, to, like, as I told about helping, if we get a chance to help anyone in this world, it's like it's an opportunity, like, to make the world a better place. It's not a burden. So never feel like that you are useless. And for caregivers, yes, it is hard, but it's not as hard as it is for the patient. So I don't want to be in his shoes. So I would rather be in my shoe than in his shoes. So
Yeah.
it's comparatively easy for me than it is for him.
But if you were in his shoes, he'd be doing the same thing for you.
Yeah, but I would not want that.
Me neither. I don't want to go through it again. I really don't. I'm so grateful to my brother who gave me a kidney.
Yeah.
And to think that in April it'll be 35 years that I've had his kidney.
Wow.
35 years. And I don't know. I have no words for it. There's no way to explain it. But I do know the frustration and the pain that you're going through.
Yeah.
And I just want to again reiterate that we're in this for the long haul with you.
Thank you.
No matter what. Okay?
Thank you, Kent.
All right. So listen, folks out there, you've heard us talk about Michael Etheridge and his need for a kidney. Get hold of us at kidneysolutions.org or give me a call at area code 830-285-2140. At 2140. 830-285-2140. And let's talk. That's all we want to do. You're not obligated. Get your questions answered, and let's go with it. He needs it. Rinki needs it.
Thank
all right. We'll see you later, Rinki. Stick around. All right, folks. We're going to talk to you later. And like I always say, keep breathing.